Hey, Dr. Barry Glaser here with another Aligner Insider Quick Tip video lesson. Today I want to talk about AOD. What's AOD? It's appointment on demand, and it's something that you can do if you're treating patients with Invisalign and you're using dental monitoring. So you have to ask yourself, why am I giving patients a certain interval of appointments? Let's say with Invisalign treatment, maybe you're seeing them every 6 to 8 weeks. Ask yourself, is there really a rationale for seeing patients on that interval? And the answer is for many people, that answer is yes. You want to make sure that you're monitoring patient compliance. You want to make sure that you're monitoring tracking. You're looking for side effects, hygiene, recession. There's a lot of things that we have our patients come in for. The question is this: are those things that we actually need the patient to be physically in the office for, or can we use dental monitoring to monitor those things remotely? And I would submit that the answer for that is yes. Now, clearly, there are certain things that you want to see patients in the office for. Placing attachments, IPR. If they're not tracking, maybe a troubleshooting technique like bootstrap elastic. Motivation, all of those things are certainly things that we need to have patients physically in the office. But what about the patient that's tracking along beautifully, super compliant, and everything's going along fine? We can monitor that on our dental monitoring dashboard and only set up appointments when the patients come in. Definitely in a pandemic, I think that's important. In New York, we're trying to maintain social distancing, and by setting up appointment on demand, we can see patients virtually on a weekly basis, but only see them in the office physically when necessary for things like attachment placement, refinements, or final records. So something to think about is going to appointment on demand in your practice. It actually took me about 2 years. I've been using dental monitoring for over 2 years now. It took me about 2 years to finally have the courage to do it. I think the pandemic probably spurred me on to try some of these techniques, and now I find it to be fantastic. In addition, I'm working less hours per week. I have more free time, more room in my practice for new patient exams. The list goes on and on and on. So it's something to think about. So if you're using dental monitoring, there is a Dental Monitoring Academy that has lots of training on how to do this. And if you have any questions, you can certainly reach out to us on AlignerInsider.com if you want, or on the Facebook group if you want to have more specific training, or if you have more specific questions about how to go to appointment on demand. So as always, make sure that you're following us on social media. Make sure that you're following us on the Facebook group, Aligner Insider Clinical Chat. I hope this is helpful to you, and thanks for watching.